Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a very bright and a successful gynecologist and obstetrician, Dr. Parimala. She is an expert in not only the gynecology, she is also expert in colposcopy as well as robotic surgery. And then she has set a world record, the Guinness World Record in screening the CA cervix maximum number of cases also. And today she is going to talk to us about the menorrhagia, that is excessive bleeding that some women suffer. In fact, this menstruation is a boon given by God or the divine thing to have a baby. But sometimes it becomes a bane and it becomes like a pain. And they start suffering when they start bleeding for more than 5 days and then heavy bleeding. So, Parimala Devi, welcome to our show and please tell us about the menorrhagia.
Thank you, madam. Respectful pranams to you. I'm teacher, mentor, everything. You are our guide. I'm really very much happy with the channel what you are running as Adhyatma, Ahara, Arogya. Lot of material is there. People should go through that, and I am at least very much happy to follow these things and also add up my little bit of services to that because of your opportunity which is given.
Thank you.
So today, madam has really taken a very good topic, that is excessive bleeding or menorrhagia. In medical terms, we call it as menorrhagia. In common terms, it is something like this month I'm having very heavy bleeding. A friends we can hear speaking or a patient coming to us telling, madam, this time the bleeding is not coming under control. Really fed up of that. I'm feeling so tired. These are the common things. So what is that normal bleeding a woman should have? When we come to that, usually a girl who when attains the menarche by about 10 or 11 or 12, these days it's a little early. Usually they start menstruation once in 30 days, 35 days, and they will bleed for days, 3 to 4 days, depending weight and their health, everything. But in people who are already 20, 25 years, where this hypothalamo-pituitary axis is stabilized, means there is a coordinated action for this menstruation. Just on the scientific fact, the hypothalamus, pituitary ovary, the andashe, and also what we call it as ovaries, in the ovary and the uterus and our hypothalamus, the brain, all the reflexes have to coordinate to each other. Then the menstruation will happen cyclically and it will stop by 3 days, 4 days, or 5 days. But here, what happens? The menstruation will start, but it will never come under control. Usually, a uterus have to have its main reflexes to control the bleeding at the end of 4 or 5 days because of the hormonal influence. These hormones are very important in starting the menstruation and controlling also. And a good uterus with a good muscle power also is very important. But here, what happens because of the surge of hormones, the progestrogens and estrogen, which are not coordinated, high estrogen level of estrogen will make the girl or the woman of reproductive age group really there is no control over this estrogen hormone in her body. That may be because of her obesity, because of her stress also, maybe because of her polycystic ovaries also. You know that polycystic ovary is so common in our girls now. Because of that ovulation is not happening properly, and there is a heavy surge of estrogen which will create heavy bleeding in them. So all these things have to be kept in mind. But other than this, when we head towards this 25 to 40, 45, where a woman will go through a lot of these reproductive chances of conceiving, sometimes aborting for some own reason, conception. All these things have to be kept in mind. We cannot just tell that, oh, she's menstruating heavily. We have to do the ultrasonography, the one of the important investigation, and some test, blood test if it is required. Because I want to even stress on thyroid values also.
Yes.
Even hypothyroidism.
Hypothyroidism, they can have menorrhagia, one of the symptoms.
Yes, they can have menorrhagia and also anemia. Just the hemoglobin is not at all good, like something less than 7, 8. Then it is definitely going to have the heavy bleeding. These common also we
So
have to keep in the mind.
that is like a vicious cycle. The bleeding
Yes,
causes
vicious
anemia.
cycle.
Anemia causes more bleeding and
Causes bleed.
again. So vicious cycle.
Yes, yes.
Okay.
So and she might have aborted. She doesn't know because her cycles have become irregular. She's
Okay.
lactating. So that time suddenly, like when she comes, we have to into all this history, understand whether it is a menorrhagia because of some gynecological problem, it is some problem of pregnancy and these things, and we have to. And same this women of this age group, they may come with fibroids because
Okay.
fibroid in the uterus is something like which is about 30% in our women. They will have big tumors here, and that will cause a lot of this surface area which will be extended. Because of the high vascularity, they may keep on bleeding. And otherwise, this muscular layer in the uterus may enlarge, hypertrophy. That is called as adenomyosis. These are all some conditions what a woman will go through.
They are
And
all
also
benign. They are
sometimes
not cancer. They are not
they
cancer.
are
It's
not
just
cancers
benign.
unless proved,
Okay.
and the ovaries also can be having some cyst also. All these conditions we have to keep. Sometimes commonly what we see, they may have small polyps like grapes like structures throughout the endometrium. That is
Okay.
because of again increased vascularity, fibroid, the small fibroids, and hypertrophied uterus, hormones, high estrogen level. These things also, and sometimes at the cervix only there can be a fibroid which will keep on bleeding. So she cannot attend to her any of these divine rituals. She cannot go to some functions also because she is all the time worried. She have to wear a pad or she have to wear a cup. So all these things will make the woman mentally depressed, and she will become very tired, loses her interest in the day-to-day activities. So we as gynecologists, when they come to us, whether there is any condition of them heavy bleeding, any copper T or some contraception. I am not telling that contraception is something copper T is bad or anything. Sometimes it can cause in every woman there will be one or two side effects. It can cause inflammation of the uterus, and it can cause that copper material, and it can cause some heavy bleeding. That will be usually controlled by some small tablets only, or we can control it once copper T is removed, and again we can insert it also. That is one thing like we have to be knowing. And so these women, when they come to us,
So in
we have
fact,
to
they may be having copper T for many years, but then it may
many
erode,
years.
and because of erosion, the bleeding may occur. So
Yes,
you
yeah,
may
it can
have to
happen.
remove that and put a new one.
Put a
So that
new
is
one
also
with
there.
some medicines given in between.
Yes.
And sometimes procedure, what we call it as DNC, dilatation procedure, will be of immense help here.
Yes.
Because the endometrium, which is hypertrophied because of the estrogen, or these polyps, everything can be actually controlled by doing this curettage. They all will be removed, especially under hysteroscopic ablation. That is by using that scopy light. Hysteroscopy means
You
through
are
the
actually
uterus.
looking into it and then removing it.
Yes,
Okay.
yes, under the evidence. Under the evidence, we'll be taking it out, and that will usually control the bleeding. That is one important treatment what we are usually giving. And also sometimes in the biopsy, what we have sent, if there is any abnormal tissue, atypia, something we are suspecting, she's already 40, 45 years, then you may have to go up to hysterectomy. One important treatment is, another one is intrauterine progestogen system, IUGS. That is something like a copper T, only a small T-shaped device is inserted into the uterus the cavity, where it is going to control all this hypertrophy, everything, and bring down the bleeding. And they may not bleed for 3 months, 4 months because of the progesterone effect.
Which you are inserting, it is a hormones.
It is hormone, but in a micro doses.
Locally acting hormone.
Local effect. And in
Because if
micro
they
doses,
take, orally, they may get nausea,
yes,
vomiting,
nausea.
giddiness, and hypertension.
Yes, yes,
But when it is
yeah.
given locally, it will be very effective.
Yes, GI side effects can be more with oral.
Yes,
It is our one of boon, we can say. We are using it since 15 to 20 years now. It can control the bleeding and make the woman very comfortable for at least 4 5 years. After that, we change it according to her age, everything, so that we can rescue her from unnecessary hysterectomies, because the high incidence of hysterectomy.
Can you do the burning also?
Yes, yes, we can do
ablation?
Ablation by a ball cautery, or by some knife, Kalman's knife like that we usually use. Another one is tissue resection. With oscillation, we use that instrument and try to take out all these polyps so that it will get ablated also. tableted
smooth,
means
it
little
becomes
burnt
smooth.
under anesthesia, so
Yeah.
that it will come under
Yeah.
control.
Bleeding points
So
are
these
all
are
controlled.
various methods
Okay.
are there to rescue the woman from hysterectomy. It is not that I am having bleeding, oh, my uterus will be taken off, my ovaries will be taken off, nothing like that.
No.
So
No.
proper getting through the channel of her problems and understanding what is going on, her general health, especially thyroid level, hemoglobin level, and her weight check, everything will add up, and we can give her a
Okay.
very healthy life, even with heavy
Okay.
bleeding. When it is more than 80 ml of blood loss is happening in per menstrual cycle for 5 to 6 days, 7 days with big clots, then we call it as menorrhagia, metrorrhagia,
Okay.
polymenorrhea. Many things are there.
Okay.
You have taught
Okay.
us and we have learned through you. So
Okay.
these are the things like we have to be careful, and our women need not get as a last tip to them. They should understand that, oh, this is some temporary phenomena. It will be corrected because it may be hormone oriented, or it may be some benign pathology which is troubling them, or because of the age also. So
Okay.
these things will help the woman to become more healthy by the good discussion with a doctor.
So in other words, you are telling that if a woman is anemic, her blood thing is less,
Yes.
she must come. And what is the cause? One has to see. And if she is bleeding for more than 5 days, if she's changing the
More than
pad
80
more
ml to
than
100
one,
ml.
then you have to do it. So thank you
Yes.
very much, Dr. Parimala Devi. So beautifully you have explained in a simple term. Thank you very much.
Thank you, madam. Thank you.